Good morning everyone. Today we are going to see another very simple topic in immunology and hematology. Actually this is coming under hematology, parasites in blood. So we have seen different components of the blood and all those things we discussed, and this is another small topic which is given in hematology chapter 1, parasites in blood, wherein we are going to see what are the different types of parasites that causes infection in human being. Okay. Now, what do you mean by a parasite? First of all, you have to understand what do you mean by parasite. Parasites, they will be in a non-mutual relationship with the host. So we are talking about the parasites in blood of the human being. So we'll be talking about the non-mutual relationship that happens between the human being and the parasites. The parasitism, it's a non-mutual relationship in which one benefit at the expense of the other. Okay, now the parasite here, in this case, the parasite is getting benefited on the expense of the host. So it is creating a trouble to the host and taking out all the nutrients which they need for the multiplication, and they survive within the human being and causes severe infection. There are two types of parasites. So in the animal system, when you see, there are two types of parasite. One is known as the ectoparasite, another one is known as the endoparasite. Ectoparasites are the one which will be growing on the surface of the body, like on the skin, on the hair and all. You can see some of the parasites which are growing. Examples are ticks, fleas and lice. They will be feeding on from the skin, and some of the parasites will be growing in the body. Okay, they are known as the ectoparasite. The second type of parasites are known as endoparasite. These endoparasites examples are bacteria, virus and the protozoans. Okay. So we'll be discussing about some of the protozoan diseases and some of the parasitic diseases that happens in the human being. Okay. Now, the first one, what we are going to discuss now, the parasites in blood. We are talking about the parasites in blood, so we'll be obviously talking about the endoparasite, not the ectoparasite. Endoparasites can be seen in the blood of the infected person. Once after the infection, the parasites which enters into the body, that can be seen in the blood of the human being. And the first one, what we have to discuss here is the first parasitic disorder is malaria, which you have studied already under paper 403. So you can write few points from that particular paper. I think all of you must have studied, or you know what is malaria, how it happens, all those things. You can just write few points under the malaria, not in detail, because you will be discussing about many diseases here. So no need of discussing in detail about the entire malaria life cycle and all those things. You can write what is malaria, how it is caused, what is a causative organism, how the infection happens and what are the symptoms, and all those things you can write under the malarial disease. Okay, and the second one is trypanosomiasis. Third one what we are going to discuss is Chagas disease. Fourth one is leishmaniasis. Fifth one is babesiosis, and the sixth one is rickettsia. So these are the diseases what we are going to discuss today. The first one is trypanosomiasis. Trypanosomiasis, that is caused by Trypanosomia brucei. Okay, Trypanosoma brucei, that is the organism which causes trypanosomiasis. Okay, this is also known as African sleeping sickness. Trypanosomiasis, that is also called as African sleeping sickness. Trypanosoma brucei remains extracellular. Okay, and first it will be there near the tissues where the insect bites, and then enters into the blood, divide rapidly, and continuous multiplication will be there. So there are two stages. The stages of trypanosomiasis you can divide into two stages, stage 1 and stage 2. Stage 1 is known as the hemolymphatic stage. Okay, stage 1 of the trypanosomiasis is known as hemolymphatic stage. Now what exactly happens in this hemolymphatic stage is, in this phase Trypanosoma brucei remains in the bite site. Wherever the insect is biting, there the Trypanosoma brucei will retain there, then it enters into the bloodstream. Okay, now this once after entering into the bloodstream, the hemolymphatic stage happens. What do you mean by hemolymphatic stage? They enter into the bloodstream and even into the lymphatic system, where it divides rapidly. The division rate will be very rapid and continuous division will be there, and because of that you can see because of the continuous multiplication and all those things, you can see various symptoms. The features of this particular stages are, you can see the enlargement of the lymph node. I have written all the symptoms here. Lymph node enlargement can be seen, fever will be there, splenomegaly, that means enlargement of the spleen, headache, voracious appetite, they will have a voracious appetite will be there, appetite will be more, they will feel like eating always, and with the voracious appetite they will have the weight loss, because the parasite is multiplying, it will take all the nutrients from the body, thereby you will have weight loss, and then the patient will be in coma stage for a few days, and then finally death. Okay, these are the various features of the trypanosomiasis infection. What is the reason for this sleeping sickness? Okay, this trypanosoma brucei, they will, when it enters into the body, they will be releasing a chemical factor which is called as the tryptophol. Okay, trypanosoma brucei, they will release a chemical called as tryptophol. Due to the release of this tryptophol, the people will feel sleepy. Okay, so trypanosoma brucei infection that causes that releases tryptophol, which induces sleep. That is why this is known as the sleeping sickness, African sleeping sickness. This parasite is transmitted to the human body by a fly. By the fly, when it bites, the organism enters and it enters into the first stage, which is called as the hemolymphatic phase. Next is known as the second phase of this infection is known as the neurological phase, wherein the parasite enter into the central nervous system. Okay, this trypanosoma brucei enters into the central nervous system. They will cross the blood-brain barrier. They can cross the blood-brain barrier, enters into the brain, and because of the infection or because of the entry of this parasite into the brain, there will be confusion, tremor, muscle weakness, and that lead to paralysis. Most of the time in the hemolymphatic phase itself, people will die. If they survive during this hemolymphatic phase, the organism, it will enter into the infection will enter into the second stage, which is called as the neurological phase, wherein the trypanosoma brucei cross the blood-brain barrier, enter into the brain, and then that lead to various symptoms associated with that, such as confusion, tremor, muscle weakness, and the paralysis. Okay, so under this particular disease, you have to remember the causative organism and the fly which transmits the disease. It is called the fly which transmits the disease. In all these diseases, you have to write the carrier. It is the fly is TES fly. Okay, that is the fly which causes or which will transmit this organism into the body. There are two stages, hemolymphatic phase and the neurological phase, and during these two stages many symptoms can be seen, and due to the infection of this trypanosoma brucei, people cannot survive for a long time and they die. Next one is Chagas disease. Okay, Chagas disease is caused by trypanosoma cruzi. This is another parasite, trypanosoma cruzi. Carrier of this disease is called as the kissing bug. Okay, kissing bug is the insect which will transmit this trypanosoma cruzi into the human body. Now this kissing bug, that will be feeding on the sleeping human. Okay, so they will feed on the sleeping human, and once after the feeding, they will defecate on the face. Okay, defecate after feeding, they defecate on the body of the human being, and in the fecal matter of this fly, the organism will be there. Which is the organism? Trypanosoma cruzi. So this organism which is there in the fecal matter of the fly will enter into the body through the small cut which is there. If it on the skin, if small cuts are there, the organism will enter, or through the eye or nose, or through the pores which are there on the body. Through that, the organism enter into the body. Okay, and since it usually feed from the face, it is called as the kissing bug. Clear? and the trypanosoma cruzi enter the body through small cuts, nose and eye, and also spread through the food contaminated with the insect fecus. So either it can be transmitted through the fecal matter which is there on the body, or if the food is contaminated with the fecal matter of this fly, kissing bug, then also the organism can enter into the body. Okay, trypanosoma cruzi. The symptoms of this particular infections are, you can see chancres, that means painless boils will be there, which is called as chagomas. Okay, so Chagas disease, the main symptom is chancres or chagomas can be seen, that means painless ulcers will be there in the body. Second one is febrile illness. Have you heard of the term febrile? Febrile means fever-like symptoms will be there, high temperature, all those fever symptoms will be there, weakness, all those symptoms will be there, which is called as the febrile illness. Fatigue, they feel very tired, rashes can be seen on the body. Hepatosplenomegaly, that means both liver and the spleen enlargement can be seen. Heart failure will be there, okay, because of this infection there will be heart failure. And then you can see enlarged esophagus will be enlarged, and abdominal pain can be seen in these patients. Okay, chancres, febrile illness, fatigue, rashes, hepatosplenomegaly, heart failure, enlarged esophagus, and abdominal pain. Okay, these are the symptoms of Chagas disease. This disease is called as Chagas disease because this is identified by Carlos Chagas in 1909. In 1909, Carlos Chagas, he identified this disease, thereby this disease is known as the Chagas disease. The first disease what we have discussed is trypanosomiasis. It is called as African sleeping sickness because the organism Trypanosoma brucei releases tryptophan that induces sleep. Fine. Now the third one is known as the third parasitic disease which is seen in human being is leishmaniasis. This is caused by Leishmania parasite. The causative organism is Leishmania parasite. The carrier of this organism is sandfly. Sandfly is the one which will be transferring the organism into the body. Okay. Now there are three different types are there. One is known as the cutaneous leishmaniasis. Second one is mucocutaneous leishmaniasis, and the third one is known as the visceral leishmaniasis. Three types are there. In the case of cutaneous leishmaniasis, you can see cutaneous. What do you mean by that? On the skin, on the body surface, on the skin, you can see ulcers. So cutaneous leishmaniasis, that means painless ulcers will be seen on the skin. Second one is known as mucocutaneous leishmaniasis, wherein the parasite will spread to the nose, throat and mouth, and this will completely destruct the mucosal layer. And you can see that in this condition, when it is there in the mucocutaneous leishmaniasis stage, the entire nasal bridge that will be completely damaged. You can just check for the images of this mucocutaneous leishmaniasis. The nasal mucosal layer will be completely damaged, destruct the mucosal layer, and you can see the nasal bridge will also be damaged. Okay, so that is known as the mucocutaneous leishmaniasis. Third one is known as visceral leishmaniasis. It is also known as Kala Azar. This will occur after 2 to 8 months after being bitten by the sandfly. So once the sandfly infects, you can see these symptoms, cutaneous and mucocutaneous things can be seen. And later, after 2 to 8 months of insect bite, you can see the visceral leishmaniasis. In the visceral leishmaniasis, as the name says, visceral organs will be damaged. All the visceral organs, especially your spleen, liver. Okay, your spleen enlargement can be seen. Even the hepatomegaly or liver can be enlarged. Liver will be enlarged, and also the bone marrow will be affected. So because of this one, you can see enlarged spleen, enlarged liver, night sweats will be there, high temperature can be seen, and bleeding will be there, and blackening of the skin. So due to the infection of this Leishmania parasite, the melanocytes will be activated, thereby more melanin production can be seen, thereby the skin of the infected person will be dark black. Okay, that is why this disease is also known as Kala Azar. So Kala Azar. Kala means black. Kala Azar because of the release of melanin, more amount of melanin, because this Leishmania parasites will activate the melanocyte, thereby you can see black skin. And two more diseases are there. One is babesiosis, that is caused by the parasite is Babesia. Insect is ticks, which will infect the RBC. Usually it affects wild animals, domestic animals and human being. Symptoms are fever, anemia, RBC destruction, jaundice and blood in the urine. Okay. The infection, the disease is known as babesiosis. I have written here, I think. Babesiosis, that is caused by the parasite Babesia. Okay, the parasite which causes this one is Babesia. The carrier is ticks, 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 and this infects RBC, affects the wild animal, domestic animal and human being. Symptoms are fever, anemia, RBC destruction, blood in the urine, and also you can see, because of so much of RBC destruction, you can see jaundice. Okay, and the sixth one is Rickettsia. Parasite is gram-negative bacteria Rickettsia. It found in ticks, lice, fleas and mites. So all these insects will have this Rickettsia, ticks, lice, fleas and mites. Symptoms are fever, headache, muscle ache, swollen lymph node and cough. Okay, and body rashes can be seen in the case of rickettsiasis. Okay, caused by Rickettsia, found in ticks, lice, flies and mites. Fever, headache, muscle ache, swollen lymph node and cough. These are the symptoms of Rickettsia. So these are some of the parasitic disease which is usually seen in the human being. So it's a very simple topic. Just you have to remember the name of the disease and causative organism and the carrier, the fly which will transmit this parasite into the body. Malaria you can write from the other paper. Trypanosomiasis, Chagas disease, Leishmaniasis, babesiosis and Rickettsiasis. Trypanosomiasis is caused by Trypanosoma brucei. This is caused by Trypanosoma cruzi. Leishmaniasis caused by Leishmania parasite. Babesiosis caused by the Babesia, and Rickettsia caused by the Rickettsia organism. Okay, so and causative organism, carrier, and you have to write about the symptoms of all the diseases. That's all. It's a very easy, simple topic. Please go through that and clarify all the doubts.